I do like a mixture of things. Like a lot of time I'm like in the hub just doing like those calls to remind people of the appointments, and then like I like to like mix it up a lot. So I might be like going to do like a TTO, so like go get like the drugs, medications, and then like bring them around, because that gets me to like move around the whole hospital. And so I just like kind of prefer being like going in and out of like wards. I always prefer trying to call them directly, because I know I personally miss voicemail, so I know like people will probably do, so I try to call them back. Well, this one I left a voicemail, that one I have to try again. Hello, I'm calling from Red Cross Hospital. I'm just calling to remind you that you have an appointment on the 6th of October at 10 for a diabetic appointment. It's a follow-up. Yes. Yes, at 10. Yeah. That's great. Take care, bye. I think the primary sound that we hear in the hub is just as the porter, they go around and bring their like, how do you call them, like just big trolleys of things. It just gets so noisy. If you're on a phone call, we have to just be like, oh, can you hold on a moment? Because like it just deafens everything. Like you can't even talk in that moment because it just gets so loud.
Hello, Laura. Yeah, the student. Were you there when? I'm here.
My typical shift will be like Wednesday from like 1 or 2, like, because usually like now it's like I haven't still started, but usually I go to uni after a lecture, whatever time it takes me to kind of get here. So it's usually between 1 and 2 I reach here, and then I may stay until like 5 or 6-ish, depending. Yeah, well, I'm studying biomedical sciences. I'm actually just starting 3rd year, so in my final year. The idea is to kind of going into like medical related fields, so like actual medicine as a doctor, or any of like the allied professionals, like clinical scientists. So when I started, it was actually a vaccination center that I started working in. It helps me in terms of CV, but it's also great for the community. And then from there, when initially it was like Excel, then we moved to Stratford, and then after that, they said, oh, do you want to come to the hospital? And I said, oh, actually, yes, I'd like that. And then from there, I just moved on to Whipcross, and then I've been doing it here. It really depends like which people are around, but definitely will include coming up at least once to the Wellbeing Hub, just to make sure like everything is in order, clean, like the dishwasher is loaded, things like that. And then it would be going to do some TTOs. So there's like medication, just pick them up. Because that's sometimes what happens is like in the afternoon, they can just kind of get piled on. So maybe if you visit the pharmacy at some point, you see that they're really, really busy as well. Okay. So they just kind of pile on, and sometimes they might not have the time to actually deliver it. And so we kind of fill that little gap in, that if there's some of us around, usually we can do that. I go occasionally on the wards as well, and what we can do on the wards is, of course, like chatting with patients, but also like maybe making them a cup of coffee or tea. And sometimes if we do go around like lunchtime, help out like the nurses in like distributing the food as well, which kind of helps them, because like the nurse may be busy like having to feed a specific patient. Yeah. So if we maybe just help them with like distributing it, it helps them like reduce that time that they need to do that. But I think favorite would be when I actually deliver the TTO medications to the ward, because I feel like many times they will be like, oh, we were just waiting for this. And so it kind of makes you feel good that, oh, what I just did actually is going to help someone. because they're like, oh, we were waiting for this, but it wasn't coming. It's like you can see more directly in that case, so it makes you also feel like, oh, I've actually been doing something.
Sometimes it's quiet, or you just hear the people walks. No, not trolleys, not beds, nothing. Sometimes you can hear the lift, up and up. When I started last year, it was quite busy because remember we had these restrictions regarding the COVID-19. So lots of patients they were denied to come, or not denied, but they were restricted to come, especially the family member when they come to visit the loved ones. So what we do, we went here, we had a laptop, database, and the family they call us to book the appointment. Yeah, so you book them slot, what time, it was only 1 hour slot, and only one person each time. So that was really busy that time, yeah. In December was quite difficult because some of the family members were trying to come, but they couldn't come because of the restriction. And when it comes to Christmas time, so it was really, really difficult to deal with the family members because, come on guys, it's Christmas time, I said, yeah, we can understand, but there is a procedure we have to follow, yeah. And speak to the nurses or doctors, whoever is in charge.
I'm looking to actually get involved and look for employment within the NHS myself. So I've kind of come to do the volunteer work because I've come from an actual different background. I have an engineering degree in motorsport engineering. So I wanted kind of like a change of pace and do something different. And where I want to go, there's a chain you have to go through. So I'd have to start off in admin, have band 2, and then work my way towards I want to go to the dietetic department and become a dietitian. So, and they provide a lot of in-house training here as well, so that way I can work my way towards that. Some days it could be just doing envelopes and letters and then taking them to the post room. Sometimes it could be telephone reminders. And some days it could be, just yesterday I did some laminating for the cancer research, so it varies day to day. I mean, it ain't like the most progressive work, but it's kind of entering me into where I want to go. It's just getting to meet all the different new people, understanding what they do, and getting to know the people around here as well, which I've really enjoyed. You've got to get either 200 hours or 6 months before you can get a reference. It would equivalent roughly to about 5 to 6 weeks. I'm trying to build those hours up as quick as possible, so it would help me to reach my goal. I mean, it's mainly the cages and electrical wires that get to you. And then you get some of these machineries that are wheeling long beds that they've got control of, the electrical wiring you hear.
Like I have been working here before, epidemic, but what I noticed working in the wards, sometimes the patients got so much to tell you, they won't leave you, and they don't want you to go.
I just visited like 4 patients in 2 hours.
And end of the day, it is amazing to see smile on their faces. I just listen to them. And if I try to spot, if I can do my best, because whatever the borderline is down here, I can't go above that, what I've been explained. But sometimes, because I've been working with special needs children, and I've been feeding them with my own hands. So when they ask sometimes, can you help in feeding? I will say yes, but then I have to find out if I can do it or not. And I really enjoy. I started after I retired from my job, 1.5 year epidemic. Then I had to stop because I'm Asian, borderline health condition, everything. And then I came back about nearly 4 months ago. I started with once a week, and then this time I'm doing twice a week. Oh, I enjoy it because the thing is the way I explained it to you, you know, when you have a patient lying in the bed for 24 hours and you have no one, even if they have a families. Once I saw the gentleman on the bed and I said, because he had his guests, and you know, when they have guests, you try not to disturb them because they have a sudden amount of visiting time. So I just waved and he said to me, come here. I said, I'm sorry because you had visitors. He said, these visitors are no good to me. Whenever they come, they talk about their fashion, about their clothes, and they never asked me how is he, how is he feeling, all that. For that reason, you know, when you go out, you meet a lot of people. Favorite moments I like, you know, before epidemic. There's a woman, they wanted to dance with me. Yeah, because they were in their 80s and 90s. And they look at us, we're going to go to bingo, are you going to come and join us? And all that. And that was my favorite moment, yeah. Because when you see them laughing, smiling, and they want to hold your hand. By this time I was told not to hug anyone. Because sometimes the patient wants to come and hug you. I let them do. It is good, you know, you instead of just sitting home and doing nothing. I won't say that there's nothing to do. There's a lot of things to do in the house. Because I worked for 28 years with special children. I was working in a school, I worked for Bernardo's, and I worked for ManCap. My daughter said to me the other day, Mom, with your age, you have to put your feet up. You have to put your feet up. Don't do too much. She always said that to me. And I said, okay, I'll do that. But then I'm sitting for 5 minutes, then you know I start feeling itchy. What shall I do next? What shall I do next? It's just like that, isn't it? Life never stops, just keep on moving around. Yeah.